Keystone has been the leading organization covering the area of the central control of feeding and energy homeostasis every other year for many years now. And this year, Keystone will take a unique look at feeding behavior and the diseases of feeding and energy storage. Generally, the Keystone meeting on the central control of feeding and energy homeostasis has focused on normal feeding and energy homeostasis and on disorders that happen in that circuitry that lead to obesity. But there are many, many other aspects of feeding behavior and energy storage, including a large number of situations, diseases, disorders, etc., where there's inadequate feeding. And so this year, my co-organizers and I, Lori Zeltser from Columbia and Matt Hayes from Penn, have invited a diverse array of individuals, fabulous scientists, to come and speak not only on neurocircuitry underlying normal feeding behavior and obesity, but also state-of-the-art work looking at the circuitry responsible for nausea and emesis, cachexia, anorexia nervosa, feeding across the lifespan. So, for example, differences in feeding behavior in children during pregnancy. And so we're going to take a much broader look at feeding behavior in this meeting in 2019. The reason why this meeting is held in conjunction with the obesity and adipocyte biology meeting is because much of the regulation of energy homeostasis involves communication between fat and the brain. And often the study of one leads to advances in the other. Study of genetic mutants with obesity led to the discovery of leptin, an adipokine that tells the brain how much energy is stored in the form of fat. Very recently, a brand new hormone called asprosin was discovered by studying a disease, a progeroid syndrome, a disease in which individuals are unable to store energy adequately. And that led to the discovery of a new fat hormone called asprosin. And the discoverer of that, Atul Chopra from Baylor, will present at this Keystone meeting in 2019. Oftentimes, the study of disorders of fat storage or excessive fat storage lead to this discovery of key signaling molecules and hormones that work primarily in the CNS. The really exciting thing about this meeting, of course, as I mentioned, is that it'll bring together people interested in the central control of feeding and energy homeostasis, approaching this from many different angles and from many different disease states and conditions. And so we've also invited a number of individuals from the pharmaceutical industry interested in not only obesity, but also emesis and cachexia. In the last, really just in the last year, there have been some tremendous advances, such as this discovery of the role of GDF-15 in cachexia, and as I mentioned, the discovery of this new hormone, asprosin. And so there are multiple new therapeutic targets out there, not only for obesity, but also diseases involving an inability to store energy. And so I think it'll be a very exciting meeting, bringing together basic scientists and scientists from industry as well. There's essentially nothing on the market to treat anorexia nervosa. There's nothing effective on the market to treat cachexia. The 4 or 5 pharmaceuticals that have been approved for obesity are modestly effective at best. And so there's tremendous need for new therapeutics, not only for obesity, but also for emesis and diseases involving the inability of adequate storage of energy or feeding. I think it's safe to say that anorexia nervosa is understudied given its importance among the neuropsychiatric diseases. Anorexia can affect up to 1% of women, and it has a mortality rate as high as any of the other neuropsychiatric diseases. And yet it receives only a small fraction of the research dollars that depression and schizophrenia receive from the NIH. So I hope this meeting will also call attention to the need for more research in anorexia nervosa. Why is the Keystone organization so important for science? This field is a perfect example. The Keystone meeting on the neural control of feeding and energy homeostasis is the leading meeting in its area. There's no other society or organization that brings all the experts together in this field like Keystone does. So this meeting has been a lot to me for my career and has been a major meeting for all of us in the field to share ideas and help move the field forward as quickly as possible.